Hari. So today we're going to look at how we want to put together a class, whether it's for our pregnant lady or if it's a regular class that we're going to have a pregnant lady in. So we need to understand what are the important things to include and how to kind of put the class together. Now, you already have the background of putting a class together for a regular group, so this is just going to be additional information specifically related to pregnancy. So first, looking at what kind of classes you want to be offering. So you may be teaching regular prenatal yoga, and you might have separate trimesters or you might have mixed trimesters. Most of the time you'll be having mixed trimesters because the amount of people who are coming to yoga in pregnancy is much less than the general population. It's a very, very specific class. And unless you're working in, say, a women's healthcare centre or in the hospitals for pregnant women, something like that, then you most probably will be having a mixed class. And that's absolutely fine. And in fact, it's nice to have a mixed class because the women who are in their first trimester, they get to meet women who are in their third and vice versa. So it's kind of nice to share and also see the progression with the women in that class. So of course, if you have separate trimesters, you can be very specific about the needs of each trimester, but generally it's not very common at all to be doing that. Then you might have a general class where you have a pregnant lady. And this is really common because a lot of women might find that they can't get to a prenatal class, or you might not be offering a prenatal class, so they just come to the regular class, and you need to have a good understanding of what they can be doing, what are the alternatives that they can do instead, and of course always remembering the yogic guidelines. Then you might have a class which is pre and postnatal. So where you've got pregnant ladies and also new mothers and possibly the babies there as well. So that is a little different class. A lot of the practices are the same, but they can vary a little because obviously for postnatal, we can do prone position asanas, but many things that are working on the reproductive system we can do for both pre and postnatal. The reason why you might have a class like this is basically just to bring different women together. It can be a support for the pregnant women to know what it's going to be like, once they've had their baby. And also some women who have had their baby, they want to connect with other pregnant women as well. And they especially want to share their positive experiences. So definitely you can do pre and postnatal classes. It's just not as common and it just takes a little bit more adjusting, but as I've said, many of the things are going to be the same. Then you might have postnatal classes, so after the baby has been born, and you may also have mums and bubs classes or mums and babies classes. So again, this is a postnatal class, but it's where the baby is going to be there as well. And I would say that the mums and babies classes are much more common than the postnatal class because most women want to have their baby with them, and many women don't have a choice about it either. They have to have their baby with them because they don't have someone else that can look after their baby, and of course their baby also needs them. So that's another reason why it can be so. So before we go into that, we're first going to look at case taking. So we need to get a little bit of information about our lady. So of course things like name, address, date of birth, email, all that stuff is going to be important for your records. You can also ask their occupation because it will give you a little more idea of how much activity they're doing, if they're on their feet all day, if they're very stressed. All of this kind of stuff is very important to have an understanding of. Then you can ask the question, how long have you practiced yoga for? So this will just help you to get an indication of their yoga experience. But still, even if they have done yoga, you also want to ask them what kind of yoga they've been practicing, because we know that there's a lot of variety in how people practice and their understanding of it. So the next question also is, was it regularly or not regularly? Because there's a lot of people that say, oh yeah, I've been practicing yoga for 5 years or 10 years, but they might do it for, you know, a couple of months, then they have a break of a few months or 6 months or a year, then they do it again, you know. So a regular practice is very different to an irregular one. Then asking how many weeks pregnant she is, that will give you a very specific time to be able to work from, and it's very helpful to make a note of these weeks and keep updating it, so you know, okay, she's going to come this week, she's now at 25 weeks, you know. Otherwise it can get a little bit confusing. And you can also ask, when is the due date? So especially when they're into the 3rd trimester, it will give you a little bit more of an idea. Then if there has been any previous pregnancies or miscarriages. So this will help you understand how the practice should be. If she has had many miscarriages before and she's in her 1st trimester, then you have to do very, very gentle practices. And of course, you need to do a lot of stress management, because she is going to be very fragile, like mentally fragile. So you need to give a lot of support there. Also with pregnancy, so if she has had a pregnancy before, you want to find out, how was the pregnancy, how did she feel? Also, of course, you want to know about her baby, and of course sometimes it can be that there was a stillbirth. It's not as common these days, but it still happens. So she would also be mentioning that, and that's something that you need to really pay attention to, because if she has had something like that happen, it's going to be hugely, hugely stressful for her, and that's going to be impacting her pregnancy this time too. If she's having any bleeding, so particularly in that 1st trimester, but also in her 3rd trimester, if there's any bleeding starts to happen. And as I've mentioned to you before, if she is having any kind of bleeding, she's generally going to be talking to her doctor and checking that everything is okay. So it's not common that she's going to be having bleeding when she comes to see you, but still you need to ask those questions. So now looking at the different kinds of health problems that may be there. Now some of these are specifically related to pregnancy, but some of them can just be problems that she might be having anyway. So varicose veins, diabetes. So diabetes, as in she might be having regular diabetes type 1, or unfortunately even type 2, but she might have got gestational diabetes, which occurs later on in the pregnancy. Asthma, epilepsy, blood clots, cancer. You know, of course, she's probably not having some of these things now, like cancer, but she might have had it in the past. So it's just good to get a little indication of this. HIV, arthritis, high blood pressure or low blood pressure, sinus problems, heart problems, headaches, migraines, depression, anxiety, knee problems. So having the problems written down makes her think about it, because otherwise a lot of the time a woman goes, oh no, I'm okay. And then they look at it and go, oh, actually I do have knee problems. Oh, I do have sinus issues. Oh, I can't sleep at night. So it's just helpful to remind her so that we can help her more. Because if we know what her problems are, then we can give her specific practices that will be really, really helpful. So depression, anxiety, definitely, you know, even in regular general classes, you'll see that around 50% of people would generally circle depression or anxiety. They might find it uncomfortable to say it out loud, but when it's on paper, they feel more comfortable to indicate it. So knee problems, allergies may be there, neck problems, sleeping problems, emotional oversensitivities, frequent urination, difficulty in balancing or difficulty in walking, tiredness, nausea, constipation, pelvic pain, sciatica. So that's where, you know, the pain is in the lower back and radiating down towards the foot. Fluid retention, heartburn, indigestion, dizziness, breathlessness, hip pain, rib pain, heaviness in the belly, stress, palpitations, and placenta previa. So lots of different problems are there. We've gone through many of these related to pregnancy. So you can ask them to circle. Then if she is having any back pain, and if she is, where in her back is it? And of course it can move around as well. If she's had any kind of recent injuries or accidents or operations, it's important to know. So for example, if you're going to be doing, say, balancing positions, you want to do the tree pose, but she broke her ankle 6 months ago, then you're going to have to take a lot of care with doing things like that. So that moves us on to recent breaks, fractures, and sprains. Then medication, so any kind of medications that she's taking, especially if there is pain medication, but anything that she is taking, it's important to know because it might be having an impact. We especially ask this question for regular yoga and especially yoga therapy because for some people they're taking high doses of pain medications, which is also not recommended in pregnancy, but many people do take them. And then what is happening is they take it because they have pain, and then they take that medication and they feel good, they don't have the pain, and they think, okay, now I can do yoga. But it's actually really damaging to do yoga in this condition because, of course, that pain medication is not stopping the problem from being there. It's just blocking the message leading up to the brain. So one can actually injure themselves much more. So it's important to know about that kind of medication. You can also ask if she's under a physician's care, so a doctor or a midwife. Now, most women will be under some kind of care. It's very rare that a woman decides not to have any care at all. But there are some people that will decide not to. There are some women that go through their whole pregnancy without seeing a doctor or a midwife, and some women also not having any kind of ultrasound at all. But like I said, it's very rare. So most women will see a midwife or a gynecologist or a doctor in their first 3 months. Basically to confirm the pregnancy, and then how often they see a doctor or a midwife will vary depending on the country, the healthcare system, and also it can depend on whether it's a public healthcare system or a private one, because obviously if it's private they can make a little bit more money if they see you very often. So that's also something to think about. Generally in, say, Australia, you'll see a midwife every month for the second trimester. The first trimester, some women will see a midwife or a doctor, some won't. And then from the third trimester, they'll start to see a midwife a little bit more regularly. So they'll see her every 2 weeks. And then in the last month, they'll see her every week. So that's where it goes from not very often to very, very frequently. But of course, in other countries, I've heard of women going every couple of weeks to the doctor or the midwife. Of course, it also depends on if there's any kind of problems that are occurring. If she's having a really healthy pregnancy, then there's no need to be getting checked all the time. So that's also really helpful for us if they are getting seen regularly by a doctor or a midwife, because it means that any kind of problems that they're facing, they will get checked, because we are not midwives, we are not doctors, so we can't say anything about their problems. We can just give guidance to help them. But of course, anything that is an emergency, anything that we're not sure about, then we definitely need to make sure that they've been checked by their doctor or their midwife. And it's really helpful to have contacts of doctors or midwives for you to ask questions about, to be able to refer them to. It's nice to have that relationship between some of them. And it will also help you because sometimes a woman might have already seen their doctor, already seen their midwife, and they're having some kind of problems, but they've been told that yoga's still fine. So it most probably is fine, but it's still good for you to just double check it with a doctor or a midwife as well. So looking at planning of the lesson. So you want to be giving a little bit of time for socialization for the women, because definitely a prenatal class is a little bit more social. It is nice for women to meet each other, and especially because many women don't have friends who are pregnant at the same time. These days there's such a big range of when a woman may become pregnant, from the teenage years up until into the 40s, for some women even into their 50s. So it's a big age difference. So it might be that she's the first pregnant of her circle of friends, or she might be the last one and all her friends have already gone through pregnancy and now have teenagers. So it's nice for her to meet other women and to realize that it's normal what she feels and all the changes, and to have another support and build that support network is really, really lovely. So it's nice if you can plan your class in a way that there's a bit of time before the class or after the class where they can have a little bit of discussion, they can talk to each other, talk about different subjects, just how they're feeling. Sharing experiences is really lovely. And you might do a little bit of that in the class as well. You might have a bit of a sharing circle. You might talk about certain subjects. You might be asking them how they're feeling, how is their sleep, or how is their back, or, is baby moving around a lot? There's all those kind of questions that you can ask. If you don't have time for them to be able to have that socialization, you could ask them to come earlier and meet in another place, because of course it depends where you're teaching from as well. Or you can encourage them to meet afterwards. It might be that they all go for a little walk afterwards, or go sit in a park, or have a drink together, something like that, which just is nice for them to bond and connect with. So you can be doing that. Then you also want to make sure that you have a little bit extra time for individual questions. So at the end of the class, at least 5 or 10 minutes where you can give them your time to help out with anything that they need. It might be related to yoga. They might be asking you other things as well, other recommendations. They might ask you a little bit about diet. They might ask you about birth. There's lots of things that they might ask, and you may be able to help them. You might not have a lot of knowledge in certain areas, so that's where you can guide them towards certain books or certain people or other kind of resources. So it's really good to kind of build up your knowledge of different information related to pregnancy, but also to know where they can get more information. Like you might know a really good Ayurvedic doctor or a naturopath or a herbalist that your ladies can be going to. You might know a very good counselor, so that if they're having really high levels of stress and anxiety, they might need something a little more than just yoga practice. So they might need a little bit of help in that way. They might be asking you about natural birth and different options. So you might know some different centers or doctors or midwives who are well trained in that and are promoting more of a natural way instead. So it's good to have those kind of links about you. But the types of questions can be really random. I've found I always get a load of questions after class, and sometimes it can be about things like, okay, how do I use a baby wrap? How do I use a sling? What are the best ones to use? What about nappies? A lot of mothers always ask about how to use cotton nappies. What are the best brands? How do we use them? How do we wash them? There's all kinds of stuff which might not be related to yoga at all, but they also want to ask you about. So, it's always nice to share that knowledge if you have it, and if you don't have that knowledge, then guide them. And I'll give you a lot of different books that you can also recommend that they read on different types of topics. So what kind of things do you want to be including in your class? Well, you definitely want to have warm-ups. There's lots of different types of yogic movements that you can use. The Pawan Muktasan Series 1, which you'll be familiar with, is just the movement of the joints, simple movements of the joints. All of those movements can be used, so they're the same kind of yogic movements. We've got, arm movements, leg movements, knee movement, all sorts of movements are there, which can be really nice as a warm-up. I write here the gentle pregnancy Surya Namaskar as well. I generally don't use it as a warm-up because I feel that it can be too strong for some women. So I usually do that pregnancy Surya Namaskar later in the class. But some people will consider it as a warm-up practice. Then you want to include some gentle kinds of back bends, some forward bending, and some twists. Of course, twists are going to be open ones. We're not doing closed twists. And you can have some simple inversion, like putting the legs up the wall. And depending on if they have any problems, you might do things like Ardha Chakrasana, the half wheel pose. You might do downward dog. It will depend on, if anyone in your class has high blood pressure or nausea or heartburn, that kind of thing. So we also want to do asanas that are going to be opening the pelvis, but also strengthening and stabilizing asanas as well. And definitely balancing asanas are going to be very, very helpful to include. So you want to have at least one nice balancing pose in your class. And we can do balancing poses from all different positions, starting from, say, Anantasana's balancing pose, Lord Vishnu pose from the side. Then we have things like the cat pose, raising one arm or one leg is also balancing. We have things like Utkatasana, the toe balancing pose. Then we have a lot of the standing positions that are going to be balancing. So there's a lot of options for balancing asanas, and you can always use the wall or a chair. And then we have labor poses. So there are some specific yoga poses that are very helpful during labor, and there's also other positions that can be helpful, and many yoga poses that can help prepare to be able to do those yoga poses in a more comfortable manner. Then, of course, there are other techniques that we can add to it because it's not only about asana. So mantras, we can be chanting mantras at the beginning, at the end as a form of meditation. You may even chant some mantras while they're in a shavasana or a side shavasana. Using a sankalpa is going to be really, really helpful. So the sankalpa can be remembered at the beginning and at the end of the practice. Using different types of mudras. So we have hand mudras, we have prana invocation mudra, different types of pranayam. Now, of course, it's not officially pranayam because we're not using breath retention, but all those breathing techniques are definitely important to include to have a well-rounded class. Then we can have meditation. So you might put some of those meditations into like a relaxation asana like we've been doing in class. So like in side shavasana, you might do a baby connection meditation, but you can also put meditations in a sitting position too. You just have to see what suits your ladies. And then yoga nidra. So you might give a yoga nidra in the class, and you can also give them a recording so they can listen to it at home. And then this last point is about positive birth stories. So we'll talk more about this in our lectures on labour and birth, but it's really nice to tell a story of a positive experience of birth because many women hear the negative stories. They don't hear the positive ones. And it's kind of strange, but often women like to tell the negative experiences of their birth. I guess it's more exciting, you can say. So because of those negative birth experiences, or birth stories, I should say, a lot of women can be really worried about birth, and they've never heard of birth in another way, that it could be inspiring, that it could be empowering for a woman, that it could be a really beautiful experience. So it's really nice to be able to tell these stories, and that's where sometimes having women who are postnatal in the class especially, if they've had some really nice positive births, they can share their experience, and that can make a lot of women feel much calmer and more relaxed. And I will share some positive birth stories with you as well, which you can also talk on. But the more women you start teaching, the more birth stories you will also hear, so the more you'll be able to share as well. So looking at the use of props, so traditionally, of course, props weren't being used, and it is really important that you are able to teach regardless of whether you have props or not. But definitely in pregnancy, it can be handy to have some kind of props. Now, most of the time you are going to have a wall, so that's very helpful. Here I write bolsters. If you have bolsters, it can be helpful so that if a woman can't lay on her back, then you can use bolsters so she can use them and have her back at a 45-degree angle. But of course, if you don't have the bolsters, then you will just do alternative asanas, and that is also fine. It can be difficult if you've got 10 people in your class and you need to have 10 bolsters or even 20 bolsters. It might not be possible or even affordable because some of them can be quite expensive. So definitely you have to adapt with whatever is around for you. We can also use the bolsters for doing things like child's pose, where we may rest into it. But if we don't have bolsters and we have cushions or we have chairs, we can use those things instead. Now I write here blankets. Blankets can be useful for folding up to put, say, under the knees if someone has knee pain, or for the help in the wrists. They might be used to put under the bottom for sitting positions. They may be used to cover up to do a yoga nidra. So especially in colder climates, it can be nice to have those blankets. And if you want to use blankets, you can ask your students to bring their own blanket in. And many women will have a specific or a favorite blanket that they really like, which makes them feel very comfortable to do things like yoga nidra in. But you might ask them to bring a blanket, say if it's not necessary for yoga nidra, but just because of some kind of injury or problems, then you might just ask those specific women to bring in the blanket. And same goes for cushions. You can ask your ladies to bring in their own cushion if it makes them more comfortable. So cushions, some people like to use blocks as well. They can be a little bit firmer than cushions, but whatever is comfortable for them. You shouldn't expect that they need to have all this kind of stuff with them. So of course, always adapting to what you have. Chairs can be useful if you're going to do like chair yoga, or sometimes it might be that you want them to do a shavasana, but you just put their legs up on the chair so that the legs at a 90 degrees, so the knees bent, can be really soothing and relaxing. Or you might use chairs for doing balancing asanas. So just if they're available for you, depends where you're teaching. And definitely walls can be really helpful as well. So especially for standing positions, you can use the wall, balancing positions, and to put the legs up the wall can be nice too. And here you'll see the last one, partner yoga. So sometimes we can use each other to help doing yoga practices, and I'll talk a little bit more about that later on as well. So now looking at the home practice, because yes, it's very important that you have a class for your pregnant ladies and they can meet each other and they can have some discussion, but it's also important that they know what sort of things they can be doing at home, because obviously doing yoga once a week is very different to doing it every day. And it's most probably not possible for you to be teaching a prenatal class every day. Because you've got to fit in all the other things, and prenatal class is very specific. And also a lot of women won't be able to fit in a class into their schedule. So teaching them in such a way that your women can practice safely, at home is really important. So you can teach yoga poses, you can talk to them about it, you can make sure they're doing it correctly, and then you can guide them as to how they can be doing it at home. Now, the next point you can see, ideally yoga should be practiced individually. It should be a personal practice. So especially pregnancy yoga, because it is very much a transformative practice, and it is a practice where one really does go inward. So anyway, we know yoga should be done in a very consistent, regular way, and ideally yoga should always be done for the individual. It shouldn't be a group setting. So here you can see the next point, pregnancy class can be much more social, it's a little bit more extroverting, whereas a home practice is definitely going to be more introverting. You might give handouts, so you might give like little lists of practices they can do with little pictures, some guidance. So that's during pregnancy, but you may also give them some handouts for postnatal practices. So especially when they're getting closer to delivering their baby, and they might start asking you, okay, so what should I do when baby's out? You know, what kind of things will be helpful for me? So you can give them, you know, a little list of practices. So especially a lot of that will be things like meditation, yoga nidra, breathing, and then just some very gentle movements. Of course, it will depend also on how was the birth. And that's why it's really important that you stay connected with them after they've had their baby. It's not going to be possible for them to come straight to a postnatal class, and it's not recommended either. But you can definitely give them things that will be helpful for them. And you might also give them different recordings, which will be really nice. It is really good to give yoga nidra recordings for them to do every day at home, but you can also do meditations, you can give them pranayams, you can even give them a full class as well, which is recorded, or you might make videos. And definitely you can do those practices, you can send those practices for the postnatal period as well. So it's definitely really important to encourage her to have more of a home practice, because we know there's so many more benefits if we can do it regularly. So looking at a class, a general class with a pregnant woman. So it is important that when you're planning your class, you understand what is the purpose of each asana that you're practicing. Why are you doing it? And when you know the purpose, then you can give them an option to take instead. Of course, many things can be similar, and if your pregnant lady is very aware of her body, she has a good understanding of yoga, then many times she can actually do a lot of the practices, but just adapting it according to her needs. But for some women, you'll have to be very specific. Okay, this is not recommended for you, you can do this instead. So for example, if you're teaching Viparit Kani, the inverted pose, you can ask her to put her legs up the wall. If you're teaching Ardha Matsyendrasana, the half spinal twist, so she can do Vakrasana instead. So instead of having a closed twist, she can twist to the opposite side. If you're doing regular Surya Namaskar in the class, you might ask her to do the pregnancy version and at a slower pace. So there's always alternatives that you can be giving. If you're going to be doing something like Kapalbhati, you know, you can ask her to do some deep breathing instead. But you do want to make sure that you have a little bit of time to discuss things with her before the class and also after the class, like how she's feeling. And of course, it's always better that you can encourage her to go to a pregnancy class. Next point, awareness during the class that she is following the yogic guidelines. So you want to keep checking on her throughout the class to make sure that she's doing things correctly. Most women will, but some women, if they don't have much understanding, they can do things that aren't recommended as well. So you always need to watch, like you do anyway in a class, you need to be observing everyone with everything that they're doing. And yes, definitely encouraging her to be coming to a class which will be much more helpful for her and much more specific, because we can't focus on all the important things of pregnancy in a general class. We can just give variations and options. And of course it is helpful, but it's nowhere near the same as a specific class. Then looking at mums and bubs classes, or mums and toddlers classes, or mums and babies classes, whatever you like to call it. So you'll see the first point says that they are very challenging for the teacher, but rewarding for the mother. And this is actually really true. It can be a really difficult class, but the women love it. Okay, so it can be difficult because it's very hard to plan that class because of all the variables. Sometimes you might think it's all going to go okay and the babies are all happy, and then one baby starts crying, and then it just makes them all start crying. One baby wants to have milk, they all want to have milk, so it really does vary quite a lot. And so you can't plan it. You can't make a baby do the things that you want it to do. You can't get a baby to be quiet whenever you want it to be quiet. It's not like that. And so you have to have a lot of flexibility in your class. So that's where you see the point. Sometimes you might feel that nothing was achieved because you had this list of practices that you're going to be teaching, but then you found that you had to change it around because it just wasn't suitable at that time. Maybe you thought that you could have the babies on the floor, playing and everything, but then, one of the babies or a couple of the babies just didn't want to be on the floor. They wanted to be held by their mama, and that's okay too, so you have to have that flexibility and don't have the expectations that you have to get through everything that's on your list. You have to just kind of go with it. So here you can see that point, very dependent on how the babies are that day. It depends on how they slept the night before, if they've had a sleep that day, if they've had any kind of issues, health issues. There's all sorts of stuff. And we know that babies vary throughout the day and every day. So yeah, you have to change things around. So plans can definitely go out the window. So it is important that the environment is really relaxed. The mother should feel comfortable, and sometimes, especially for a new mother and having her baby, it can be stressful. Her baby cries, she might feel embarrassed, she might feel worried, she wants the baby to be quiet quickly, but babies, they do as they want. So it's just important that she feels comfortable, she feels supported, and to remind her that it's very normal for, babies to be grumpy sometimes, or irritable, or cry, or just want you to hold them. It's all normal. It's just what happens for babies. Some babies are very, very calm and relaxed and content, and other babies need a lot of attention. And there's no good baby or bad baby, there's just babies. So it's important that she feels comfortable. If her baby is crying, she should feel that she can attend to her baby in whatever way she feels she needs, whether she wants to give her baby some milk, whether she wants to rock her baby. Sometimes she might prefer to take her baby outside. Like I know that one of my babies was always happier if I took her outside. She never wanted to be inside. But then also she never wanted to be put down. So they're all different. All babies are really different. And we can't compare any baby, but we can make sure that the mother feels comfortable to do what she feels is necessary. If she needs to change her baby's nappy, whatever it is absolutely fine. And that can also be a really helpful thing for the mother, just to realize that it's normal, that she is normal, that she's doing all the right things, that her baby is normal, because there's a lot of preconceived ideas on how babies should be, that babies should sleep at this time, should feed at this time, that there's something wrong, if the baby's crying. But, it's just a way of communication. And like I said, they're all different. So it's really helpful to have a class like this where mothers can realize that, oh, it's not just my baby. Oh, your baby also doesn't sleep through the night. Oh, that's normal, because there are some really funny ideas that society gives. So yeah, having a really nice, relaxed environment. And it is common that, okay, one baby wants to have some milk, And then the others are like, oh, yeah, I'd like a bit too. And it might be that you end up with a whole circle of women feeding their babies. But that's nice too. So you might have thought, oh, we'll get into some different asanas, but then everyone's feeding their baby. So you might have to move to, okay, let's do a little bit of pranayama. Let's do a little bit of relaxation of body parts while we're sitting in this position and feeding our babies. So you definitely have to be flexible with what you're doing. I find it really nice to have a circle because then all the women feel more connected. And sometimes you can put the babies in the middle. Of course, it depends on the babies. Otherwise, you might have something just next to the mat that you can put the baby down. Sometimes, depending on the baby, you might also have slings, baby slings, or baby wraps that you can apply too. Then you want to incorporate yoga for both the mother and the baby. So to keep the baby interested too. So you can do things like you might be doing the cat pose where the mother's doing the cat pose, the baby goes underneath, and then the mother can do peekaboo, where you bring your head up so baby can't see mama's face, and then bring the head down and say peekaboo, and babies love it. There's a lot of different movements and asanas that you can do with babies and they really, really enjoy it. And you can also do different movements for the babies, like different stretches. You can do baby massages, all sorts of stuff that can be done in the class. So the next point is teaching them how to relax amongst the chaos. And this is a really, really important technique because basically there's always going to be chaos around when there's kids around. And we need to know how to relax, or we need to teach them how to relax. I remember a friend of mine, she had quite a few kids and they were all under 5 and they were just running around the house, going crazy as kids do. And she was like, okay, I'm just going to do tree pose. And she just did tree pose in the middle of the living room with all the kids running around, and that's what was needed for her at that time. And that's important, that we should be able to keep that balance, that focus and that calmness even when things are crazy. So the next point, yes, it is definitely a strong social aspect. New mothers like to meet each other. It's really nice to share experiences. It's really nice to support each other. And it might be that these mothers were pregnant together in your class, and then they have their babies, and then they're having their classes together with the babies, and they may be friends for life when they meet together when they're pregnant or with new mothers. I know there's a lot of mothers groups that stay friends even after 20 years. They're still friends and their kids grow up together, and it's lovely. So it's really nice to build those social connections. You might bring toys to keep babies occupied. So you might have even just things that they can play with that feel a little bit different. So some sensory things. You might have a couple of blankets. You might have some cushions. So it can be helpful to have cushions if the baby rolls a little bit, so to kind of keep baby in a certain place. So those things can be helpful, or you may ask the mother to bring some things that she thinks are needed for her baby. And then, of course, that last point, not having too many expectations, is really important. I've also written mums and bubs or mums and toddlers because you might decide that you're going to have a mums and babies class up until where they start crawling, and then you might have a different class after that. Now, you might have a class for them all together, but definitely it can be more challenging when you've got both babies and toddlers, because the toddlers can move more, so they can sometimes do things to the babies. Like I've known some toddlers go and like poke babies or push babies and things like that. So actually teaching mums with toddlers is a little harder because they move around a lot. So you need to also make sure that the space that you're in is going to be really, really safe for a toddler too, so they can't put their finger in a electric socket, they can't hurt themselves in any way, they can't pull things down or break things. So it should be really, really safe. So the last slide here we're going to just look at very briefly is about the micro lessons that you're going to be starting. So you're going to be teaching 5 micro lessons. Now you're already teachers, so you already know most of the techniques, but these practices we're going to do specifically related to pregnancy. So opening of a class with 3 warm-ups, teaching of an asana, revision asana, teaching a pranayama, and then relaxation or meditation, and finishing with closing of the class. So we'll be doing these micro lessons together in small groups. And we'll talk a lot more about those closer to the time. Hari Om.